Back now at 8:13 with today's health, and this morning what could be some major changes to mental health care after years of review and debate. The American Psychiatric Association has approved widespread revisions to its manual, which is used to diagnose and treat millions of people. Adding to the controversy, some mental disorders are being added, others cut out. What does it all mean? We asked psychiatrist Gail Saltz. She's a Today contributor. Dr. Gail, good morning to you.
Good morning.
Well, first of all, this is called the DSM-5, and I know people in your line of work know it like the Bible, but just for the rest of us, what is this and why does it matter?
This is the guide that contains all of the symptoms of every mental health problem you could have, grouped so that they are in diagnoses that make sense. And this is really the guide that doctors will use, other mental health professionals will use, insurance companies will use.
It affects whether, if you're diagnosed with a certain thing, whether or not insurance will cover it.
It's reimbursable or not, exactly. And this will be the guide that will determine what diagnosis you will get and therefore what treatment makes sense.
All right, let's talk about some of the headlines to come out of them. One of them is an illness that's been removed. Asperger's no longer part of this manual. What does that mean as a practical matter?
Well, I know some people with Asperger's are really distressed about this, but really what it is Asperger's has always been understood to be on the mildest end of autism. So its diagnosis is disappearing, but it will be subsumed, it will be included as a mild form of autism in the autism spectrum disorders. So that's what the new disorder will become. It's not that Asperger's patients are going away or the diagnosis is going away. The good news is Asperger's patients are concerned this means they won't get reimbursement because their diagnosis is gone. But actually, many states and schools actually don't provide services for Asperger's as a diagnosis, but they do for autism.
So maybe will ultimately be beneficial.
So some people will actually potentially get services covered that they wouldn't before.
All right, that's one diagnosis we no longer have. What about some that have been added? Binge eating?
Yes, this is really actually important. Some people eat huge quantities of food in a short period of time, feel sick, and feel guilty afterwards. That's what binge eating is. It wasn't in the diagnosis before. There was just anorexia or bulimia. However, many people just have binge eating and don't have those other eating disorders. By putting this in, we provide a category for people that have just this, and they have a different treatment from people with other eating disorders, and they'll get reimbursed for that treatment.
Another addition is hoarding. Was this treated as what, an anxiety disorder before?
Hoarding was often included as a symptom of obsessive compulsive disorder. And indeed, sometimes it is. But we now understand, because this is the updating of the guide, includes all the science of the last 18 years, that many people have hoarding and no symptoms of obsessive compulsive disorder. So they will now have their own category because they have their own treatment and, again, their own potential reimbursement.
There's also a new diagnosis. It's for children who have severe recurrent temper tantrums. There's a new name for this. How is it defined and diagnosed, and how do you deal with the issue of whether or not this is just normal childhood behavior or something that merits a psychological diagnosis?
The reason that doctors decided it was important to have this category is there's concern about overdiagnosis of bipolar disorder in children, and therefore over-medication. So this is a category for kids aged 6 to 10 who have extreme temper tantrums, like several times a week for at least 3 months, and they must be between the ages of 6 and 10. So if this is going on, but you don't have the other symptoms of bipolar disorder, then this is the diagnosis you would receive. It needs to be seen not only in the parent, but in other people outside. So we're talking about pretty extreme behavior with anger and irritability in between. I think most people will be able to see this isn't typical child behavior, and that's why it's there.
Well, there's a lot to unpack. The full manual comes out this spring. Dr. Gail Saltz, thanks for the headlines. Appreciate it.
My pleasure.